Hello everybody, it is January and we are talking about resiliency because we just survived 2020, so let's talk about how to do better and feel better in 2021. This is a topic I'm least qualified to teach on, but I'm going to tell you the things I know to do that not necessarily what I actually do. But I actually do this one, not for a while. I need to do it again. But my first tip is to go to therapy and not go take your kids to therapy, because we all do that like multiple times a week, but I'm talking about yourself. And I'm not just talking about you don't need OT, right? Go and talk about your feelings with somebody who you get along with. So say, I've done therapy before, I didn't like it. You didn't like that therapist, that wasn't your person. The therapy is a very individualized experience, so there's different kinds of therapy and there's different kinds of therapists, and so make sure you find one that works for you. Don't give up after the first try. I know that it can be hard to talk about these feelings, but as we do, we become much better parents for our kids. Me going to therapy over the last few years has made me a much better mom and a much better wife. And so if that's the step you need to take in order to take care of your family, that's what you got to do. If it helps you think I'm taking care of them because taking care of yourself feels so yucky, then maybe that's it. That's how you got to look at it. So go find a therapist you get along with. If that's not your person, go find somebody else. You can do just talk therapy, regular cognitive behavioral therapy. I also do EMDR, which is eye movement desensitization and reprocessing. We said it right. And that started out in Washington State, so it's much more common on the West Coast. But basically, they move their finger back and forth, or we have tappers in our hands, or sounds in our ears. And the idea is to cross the brain hemispheres to help trauma settle in the brain. And it sounds kooky, but it works. So maybe that's something that you need to look into also. There's a lot of different approaches to therapy, so find the one that works for you and go do that for your family.